It is just a huge, huge honor today to be bringing back to the show for a second time my friend, my mentor, my idol, Jack Dillenberg. The reason I brought him back on the show is he just came out with a book, an amazing book called You Don't Know Jack, My Long Strange Trip Through the World of Public Health by Jack Dillenberg, DDS, Masters in Public Health, with his co-host and author, Michelle Berry. Hello, Michelle.
Hello, thank you so much for having us on.
Oh, it's an honor. You Don't Know Jack, My Long Strange Trip to the World of Public Health by Jack Dillenberg with Michelle Berry takes readers on a captivating journey through his life of public health service and leadership. From his humble beginnings in Queens, New York to his impactful work in Jamaica, India, California, and Arizona, Dillenberg shares inspiring stories of overcoming challenges and making a difference in the world. Through his engaging narrative, Dillenberg reflects on the lessons he learned from mentors, public health professionals, and everyday people who shaped his path. Join Dillenberg as he navigates the complexities of public health, encounters influential figures like Senator Barry Goldwater, and discovers the true meaning of leadership. You Don't Know Jack is a compelling memoir that will inspire readers to answer the call to serve their communities and leave a lasting mark on the world. Dr. Jack Dillenberg is Dean Emeritus of A.T. Still University, Arizona School of Dentistry and Oral Health, the only dental school that includes oral health in its name. You might know it as ASDOH, after serving 15 years as the inaugural dean. After dental school, he served as a dentist in the U.S. Navy, then practiced at a residential facility for people with severe disabilities before moving to Jamaica to work in a very rural clinic for their Ministry of Health. Prior to joining ASDOH, ASDA, Dr. Dillenberg was Associate Director for Public Health Programs in the California Department of Health Services, and prior to that served as Area Health Officer, serving the West area of the Los Angeles County Department of Health Services. During most of the 90s, Dillenberg served in several capacities in the Arizona Department of Health, including 4 years as Director, where I had the honor of meeting him for the first time. Dillenberg is the recipient of a great number of honors and awards, including the Arizona Medical Association, Humanitarian of the Year, Fresh Start Foundation Man of the Year, Harvard School of Public Health Alumni Award of Merit, and Lifetime Achievement Award from the American Academy of Developmental Medicine and Dentistry. Most recently, the American Association of Public Health Dentistry Distinguished Service Award. I could go on for 40 days and 40 nights. I just want to say this. I live in this guy's backyard. He is a legend in Arizona. I don't know what you think of him in Florida or Texas, and I don't really care, but in Arizona, in his backyard, he is a legend. Let me tell you a couple of Jack stories that just set me off totally. You know, the night before dental school, everybody's in their bed, sick as a dog, nauseous, scared to death. You know, the next day, Jack knew that, so what did he do? He invites all of his dental students over to his house the night before and gets them all shit-faced drunk, calls them by his first name. I mean, he was like a dad, a grandpa, a mentor, best friend for all of them. I mean, if they were debating the serious, biggest V fork in the road, they go to Jack. Jack's always available. I remember I was in Bullhead City. And I was at Bullhead City, you know, and I got two real big curiosities. One was always dentistry. I mean, since I was 10 years old, I wanted to be a dentist. I wrote my dental school letter in the 7th grade asking him how to go to dental school. And the other one was business, because my dad was poor as poor, had 7 kids, and he got a Sonic drive-in franchise. And he went from making $11,000 a year serving Rainbow Bread to $60,000 a year with a Sonic. And then he opened up one every year for 9 years, and we just got baller rich. And I just thought, man, it's weird how business can change your life. And so I always ask people, well, how's business? I mean, is it going up? Is it flat? Is it going down? And he goes, well, what do you think? It's going down. I said, why? And I said, well, what do you think it is? And he goes, it's that stupid ass ASU. He goes, I need mechanical engineers. I can't grow my business without mechanical engineers. And every time one of my boys applies to ASU to be a mechanical engineer, he doesn't have the right grades. He doesn't have the GPA. And they always let some kid in from Scottsdale who's never, ever, ever going to graduate and go back to Bullhead City. And I told that to Jack, and he said, absolutely. He says, same thing with all these Indian reservations. Every time some kid on the Indian reservation that speaks their language applies to a dental school, they didn't quite have the right GPA or the right DAT score, so then they don't get in, and then they send some guy like you to Tuba City who doesn't know the language, who doesn't know Navajos, you don't know Jack. And Jack said, you apply. You're qualified, you apply, we're going to take you. And I wish you'd go to ASU and take that mechanical engineer dean by the hair and drag him to Bullhead City and make him face the consequence, because all they care about is trying to get the highest GPA to get on USA News and World Link, blah, blah, blah. And Jack said, I know my Indians. I know my Navajos. They want someone who was born on the reservation to be their dentist. And I just love you, Jack. I've had a bromance with you since the day we met. And with that picture on your book, my God, I didn't know you were that damn good looking. I mean, look at that guy. Now I have a serious bromance with you. But it's okay. I'll shut up. Tell me, how's life?
Life is good. I'm lucky. I live here in Jerome. We have just under 400 residents. I was the mayor. Now I'm on the town council. And I just love still having the opportunity to make a difference in the world and getting the book done when I did, with the help that I've got from my co-author over here. And it's great. People are loving the opportunity to make a difference. I look at the world now with the election, with the president and everything, and we got a rough time ahead of us. And I think we need to do whatever we can. I was excited when I got the job that I got, that I could bring in people from states that didn't have a dental school and bring them to our school. We had 2,700 applicants for 227 spots. It's crazy. And it was wonderful. And so I love our graduates. I love what the difference we're making. I know the work you did with the dental disease, and it was important to you to make a difference, and you did. And I'll never forget it. And no, I'm honored to be able to put this in a book and encourage young people to make a difference. That's the key. They can make a difference. I grew up in Queens, New York, Forest Hills. My father never went to college. My mother never went to high school. I was lucky to get into situations where I can make a difference. And it worked out. I remember when I was heading up being the dentist for Arizona, I get a call from the governor's office, Symington. I never even met the guy. And he says, Jack, this is Fife Symington, the governor. Would you please come to my office? I said, really? I thought it was a prank call. So I go to Symington's office. He said, Jack, we're meeting for the first time. I hear nothing but good things. I want you to be director of the state health department. I said, what? He said, yes. So for 5 years, I was director of the state health department, 5,000 employees, $15 million a year budget. And I was only the second dentist in the history of the United States to run a state health department.
That's amazing considering you weren't even a real doctor.
Correct. Exactly.
My
I know,
God.
it blew me away, and we did some great things. And I'm honored by it. And thank you so much for having me on the show. I love your company and all the things that you contribute to making America a better place.
Go back for a second to what you were talking about at the top about Jack really going out of his way to build relationships with the students when he was dean, because in the book he talks about his dean when he was at NYU, the College of Dentistry there, and he had kind of an adversarial relationship with the dean there.
Yes.
In fact, when I was working with Jack on the book, and we spent many hours talking, he actually literally said the dean hated my guts. And I thought, can you imagine paying to go to school and the person in charge of your education actively hates your guts? It's crazy. So I think, that all of those experiences informed Jack's decision when he became the dean of ASDO of I'm going to be a different kind of dean to these kids. I'm going to be the dean I wish I had had when I was in dental school, because he and all of those kids back then in the late 60s were going through it, with Vietnam, with the draft and all of that civil unrest. They could have really used a mentor like that, and they didn't have one, So I just thought that was a beautiful, full circle story of somebody coming up through that very outdated dental education system who helped reform it and then put on the white coat and became a dean himself.
Well, there's only two of them that I've ever even heard of that existed. I mean, when the University of Missouri Kansas City used to send me a deal for a fundraiser, I seriously, the first thought I had is I wanted to go take a dump in a box and overnight it back to them. Just everybody says that about their dental school, except for two deans. There's only two deans where every graduate loves their dean, and it was Jack and another one. Do you know who the other one was? I'll give you a hint. It was in California. Degoni, Art Degoni.
Patagonia.
Art Degoni was just,
He was great. He used to write me. He used to call me. He and I got along well. I loved him. He did so much. And you're absolutely right. He and I were two people that really made a difference.
And the rest, like, you can't get mad at your parents, because who raised your parents? Your grandparents. And who raised your grandparents? Your great-great-grandparents. And who raised them? Neanderthal, Denisovan, and Lucy, right? Homo erectus. It was my, so they all get better. And our deans were of the model of the Marine Corps, tough love. Like you bring them up your first wax crown deal, and they just like crush it in their fingers and throw it down and say, "Do it again." And they thought they were doing their job, like some cretin parent that thinks that if you don't beat your kid with a paddle and a belt, that he's never gonna have any discipline. So they're just cretins. And Jack and Degoni were completely next level. And hell, these days you're just lucky if the dean is a dentist. And Jack, I want to ask you some controversial things. First of all, we all are on a journey, and not everything's perfect, but you missed out one thing on your long and distinguished career list. I post this, R.I.P. to Morton Thomas, Mort Copenhaver, who died. Remember this guy?
Yes.
Yeah, and he was one of the first DSOs out here, and he pioneered that. I actually worked for one of the first ones when I was building my dental office. I worked for Ed Silver, who had Sunshine Dental. He had a north, south, east, west. And I loved that DSO because all the good dentists, they weren't real doctors, because they were all they were all closed Saturday and Sunday. And I used to tell dentists, they'd say, well, they don't even think we're real doctors. I said, you're not. I said, I got 4 boys. If they fell off their bicycle and broke their arm on a Sunday afternoon or Christmas, I could, without appointment, I can drive to the hospital, and there's going to be real doctors there and real nurses, and they will treat them. If I tried to call you, you're unlisted. Only drug dealers and dentists are unlisted. Don't have their numbers out there. You're not a real doctor. You're a banker. And Ed Silver was the first one that had a dental office open 10 to 10, 7 days a week. And the 4 months I was building my office, I got to work there from 10 to 10, 7 days a week. And to get out of UMKC, I had to do like 54 amalgams, 15 units of dentures, 15 units of removal. I was doing my requirements every week, 4 weeks a month for 4 months, and met some guys out there like Nick Gidwani, who, when I first got there, I would pull out the top half of the tooth, and then the roots would be stuck, and then Nick would come over and show me how to get the roots out. And I sort of got 4 months of watching Gidwani do that. I could get out every damn tooth. I think I only had to drive a patient to an oral surgeon, Dr. Gass, maybe 4 times before I finally, no tooth could survive me. I had the skills, and Mort Copenhaver was another pioneer. I think you worked with him for a short time. And they were all trying different models, and it's real easy to be a critic on the beach. Say, well, they should have done this, or shut up. You weren't doing anything. You were closed on Saturday and Sunday. You weren't advertising on TV. But I want to ask you a hard-hitting question. Mort Copenhaver was a dentist. Ed Silver was a dentist. You have major DSOs now that the CEO ain't even a dentist. And then on Dental Town, these workers that work for him will say this crazy shit, and they'll say, well, do you think this is clinically sound? I say, well, I don't know. Isn't your CEO a doctor of dental surgery, you moron? Rick Workman of Heartland and Rick Kirshner of Comfort. Look at Boeing. Boeing had their second biggest manufacturing plant out of Seattle and Wichita, where I grew up. And the CEO of Boeing was always a aeronautical engineer where the young ones are just like, oh, I can't believe it. They'd write down everything he said. It'd be like they're Peter Dawson or Carl Misch or Gordon Christian. And then Wall Street came along and said, screw that. Let's get a business guy and let's move the headquarters to Washington, D.C., where all the big money is. It only took 3 years and their planes were falling out of the sky and they just made the worst decisions ever. And now some of the biggest DSOs, they don't even have a dentist in charge. Do you even think that should be legal?
No. I think, dentistry is a wonderful art and science. And I think that I was just delighted that we changed the model at our school. We took so many students and we just rotated them through, and I sent them to all over so that the fourth year they spent more than half the fourth year in different towns around the United States doing dentistry and for underserved populations and realizing how critical they are to improving the overall health of the patients they serve. I mean, there's still too many dental schools now that all they do is, these crowns and bridges and expensive things. And I'm hoping that maybe this book will inspire some young people to get back to doing the things they should be doing, which is making a difference in people's lives. I remember for me, the biggest thing at NYU when I was there is wearing a tie. That's what they wanted you. You're not a dental student unless you wear a tie. I said, screw it. No, that's not true. No ties. We're here to help people, not just wear ties and freak them out. And I think so it took some balls and it took some changes and it made a difference. And I look at the graduates that have come out of the school when I was dean, and they're all making a positive difference somewhere in the United States. And I'm so proud of them. And I think that hopefully we can encourage more young people to do that. You're 100% correct. It's not what a lot of schools are promoting right now. We need to remember it's about health and integrating oral health into overall health so that they can take care of themselves and their families.
I remember me and your clinic floor dean, Eric Harris.
Yeah.
And we took some of your students to an orphanage in Tanzania where there's like 300 orphan kids that fix up all their teeth for a week. And I would always say, I said, Jack always finds the best students. I mean, every one of them was on a soul searching journey. And I remember another trip to Chiapas with some of your students. And these guys, so the night before, we're getting there and we're going to have some nice food and we're going to go out and have some drinks. And your students couldn't go. And I'm like, yeah, well, let's go out, let's go get some drinks. We're going to be busy for the next 4 days. Let's go tear up the town. And I just can't. And I said, why? What's wrong? He said, it's raining outside and they're already lined up in the rain. They're going to stand there all night in the rain with their baby trying to get care. And they're like, do you care if we just start working right now? And I thought, oh, and we got out the instruments. And I mean, and when you're a dentist, and you're seeing a lady that walked for 2 days, 3 days, standing there in the pouring rain. In Chiapas, the joke is, in the winter it rains every day, but in the summer it rains all day, and they were just standing there in the pouring rain, just hoping that some American dentist could see their baby.
When I moved to Jamaica, for 2.5 years, I lived in a little thatch house. It's on the cover of the book. That was my dental office, and taking care of people there was such an honor for me, and there was such a great need, and I think that hopefully we'll continue that, and people will recognize how special it is to be a dentist and what difference they can make in people's health. And
Jack, no one's gonna ever see that dental office. They're just staring at that ripped abs. You just pointed out, it's like, oh. I was like, oh, there is a dental office behind there. I was just looking at that six pack thinking, damn, dude. Now, was that genetics or was that a lot of crunches? Or?
And that's when I worked on Bob Marley, and I had quite a following of famous people in Jamaica, you know what I mean? And he was one of them.
So, Jack, I want to ask you a philosophical question. I mean, sometimes I would get intellectually lazy and I would just sit there and say, why do I care more about this patient's teeth than they do? I mean, I'm thinking about taking out that filling I just put in because the contact isn't just right, and I want to make it a better contact. And then you're sitting there knowing this person's never flossed. There's a ham sandwich between all his teeth. And now these idiots just wanted to take fluoride out of the water because they think it's a communist plot. And they're so, they don't floss, they don't brush, they take the fluoride out of the water, which a lot of people give me credit for fluoridating the Phoenix City water. I got the Arizona award, but I didn't do crap. I met Jack. I called Jack up and I said, how come Phoenix isn't? No, do you remember the actual question I called you? Can I tell you how dumb I was?
I'll tell you how dumb I was to do it.
Let me tell you how dumb I was. I called up Jack Dillenberg. This is a true story. And it was like 87. I said, I can't believe I graduated from UMKC Dental School, 4 years of college, $87,000 in student loans, and they never even taught me black kids have superior genetic teeth and are immune to decay than Mexican kids, because I'm sitting here and these kids coming in from Guadalupe, they all need pulpotomies, chrome still crown, but I was in Phoenix there, but I was in UMKC for years, and they would bring a busload of some rich dentist died and left his money, and they'd bring in a busload of all these kids, and it was all black, like 3, 4, 5 miles around dental school, and all you would do is pray that maybe one of them had a cavity that needed a pulpotomy, and you'd say, do you brush? No. Do you floss? No. Do you have toothpaste? No. And then you take extra teeth? Perfect. And I'm like, damn. I mean, you just couldn't find one. And then I said, they never taught me that Latinas had, and Jack's like, no. Kansas City has fluoridated water and Phoenix doesn't. He said they fluoridated their water there, and they're, that good fluoridated water, and it works, and we don't need fluoridated water. I said, are you serious? And then he started explaining the water fluoridation, and I said, so you're telling me that I'm just going to sit on this assembly line 40 hours a week, 50 weeks a year, from 25 to 65, because these idiots are too dumb to put fluoride in the water? And he goes, yeah. He says, why don't you? He says, Howard, I'll mentor you, I'll coach you, and we'll start the deal. So I went there with Jack, and I brought my hygienist, and he made up this name, Arizona Citizens for Better Dental Health, and he wrote the entire playbook. I did everything Jack told me to do, and a year later, the city council put it in, and it was all you, Jack. And I realized it with COVID. I mean, the pandemic came out, and it took almost 14 seconds for every American to become an expert in virology, epidemiology. I mean, my mom knew more about it than I did. I'm a dentist, and they just they know just enough to just, I mean, what? And so these dentists are now like, you know what? They don't brush, they don't floss. You want to take fluoride out of the water? Why am I going to bust my ass doing the best dentistry I can on an idiot who just shoots himself in the foot all day, every day? Talk to that dentist. Talk to me. I mean, it really plays with my mind.
Thank you for what you've done. It really made all the difference in the world. I owe it all to you. You took it on. We had great discussions. We went over a lot of the facts, but you took it and made it a reality. And people should be so appreciative of what you did, when you did it, and how effective it was to get fluoridation in Arizona, in Phoenix. Thank you.
Thanks, Jack. But back to that patient. I mean, how do you get fired up to treat a patient who just?
And now we have so many people that are coming into the United States from Mexico, from other countries that haven't had dental care, don't have money, and we're trying to figure out what to do that's fair and effective and healthy. It's not easy.
And when we were writing that chapter, Howard, we started writing this in 2019 before COVID, and looking at what's happening now with who's in charge of public health at the federal level, and this talk about removing fluoride from the water at a federal level, like we never would have thought that was even a possibility, but I think in that chapter we cover some of those town hall meetings in Phoenix. I don't know if you were at some of those meetings that Jack held when he was the health director, but it was the same bad information back then in the 90s that people are using now about fluoride causing developmental disabilities in kids, or mind control, or that it makes you gay. I mean, just crazy, crazy stuff. But I think the difference between back then and today is that there's no social media or YouTube to like propagate this crappy information, garbage in, garbage out. Like, I think with people like you and people like Jack and, responsible, ethical people who could kind of counteract that misinformation with the truth and data and science. We're in this new era now where like nobody believes that, or not nobody, but a lot of people don't believe that. So I think it's kind of a different world than when you guys were fighting this battle back in the 90s and people were still believing in science and open to changing their minds when they had facts, right? So I think, I don't know, I mean, if you're a dentist and you're treating people who are hearing all of this bad information, maybe it's a matter of like going back to giving them the full context of like, oh, that old chestnut about fluoride causing this or that, like I've been hearing that for 40 years and it's not true. And, I don't know. I think maybe it's just like one patient at a time, just trying to debunk some of that the best you can. Um, and all that, this new era of like doing your own research, right? Like, what does that even mean? I think that public health, true public health professionals, it's like it's kind of on them now to try to put some good data out there that people can believe. And it's tough. I don't envy anybody that's trying to get into
I
this
just
field.
I just cringe, Joe, every time you say the word believe, because I think that's actually the issue. I mean, I've lectured in 50 countries around the world, many of them countries 4 or 5 times, and it's like the United States is a big country, but half the country are believers and half live in the present and read and try to figure out a problem and a puzzle, and the believers start with what they want to believe, and then they just look for stuff that fills in their deal, and they're believers. And like my two oldest sisters went straight into the Catholic nunnery right at graduation of high school. What do you think I could say to my sisters to make them just like become a Lutheran and approve birth control? Nothing. Nothing. What do you think? How long would I have to lecture to them to make them be Hindu, Buddhist, become a Jew or a Muslim? It's just they're believers, and they will never change their mind. And all they do is search the internet for things that look like that fit into their belief. And then you got the other half that are sitting here living in reality in the present, and they're just like, okay, well, okay, you're comparing apples to oranges. I mean, look at COVID. COVID was the best example. I mean, not only did all the believers know more than the Centers for Disease Control in 60 seconds, in less than 60 seconds, and then what did they do? They ran straight to the store and bought out all the toilet paper. It's like, so where their thinking thoughts were coming out. They're like,
Right.
yeah, I mean, yeah,
Garbage in, garbage
yeah.
out, right?
Yeah, we had a toilet paper shortage because the believers finally got religion that they were an epidemiologist. I mean, it's just. And those are generational things. I remember, those are things that don't happen over generations. I mean, it takes generations for them to have
I think
children.
we're in a tough time right now, and I'm just hoping that people realize they have an opportunity to make a positive difference. And they need to seize that opportunity to keep their children healthy and their community members healthy. And they can do that. And that's one of the reasons why I think this book is good and effective and will be more popular, because it'll help people understand that it's not that difficult to help other people understand they play a positive role in improving the health and well-being of Americans.
And Americans is all Americans. I mean, this is E pluribus unum. And a lot of people will badmouth your dental school because they'll say, well, other dental schools have higher DAT admission score. It's like, well, did they put anybody on one of the 17 Arizona Indian reservations?
Bingo.
Did they send anybody to the poor Hispanic, the poor? I mean, wherever there's big money, you see all the DSOs. The only DSO that all the DSOs target $60,000 a year medium household, higher urban with dental insurance. And there's only one DSO that says, oh, we'll take the other ones. Well, two of them. Comfort Dental, Rick Kirshner. He says, we take Medicaid, Medicare with an honor. And Aspen. They actually have a removable denture deal. And I lost my mom's brother, my uncle. I lost him to Aspen because when he come to my office, I would have to take it and then send it to the lab. And then they get it back at the end of the day. And so he was without it all day. And he found out he'd go to Aspen and they have the lab there. And he learned it from all his golf buddies. And you just take it out. The guy fixes it. One appointment. And Aspen and Comfort Dental, Rick Kirshner and Aspen are the only ones going where the money ain't. And they're kicking butt. And I always tell dentists, every dentist wants to own a Ruth Chris. Well, I don't know. I wouldn't mind owning McDonald's. I think there's some money to be made owning McDonald's. Why can't you just make a hamburger, fry, and a Coke? Why does everything have to be a filet mignon? So I think U.S. News and World Report is an evil magazine. I think it's a complete disservice to America, and they need to quit ranking law schools, medical schools, and dental schools by all their metrics. As all their metrics are, it's all right if you're all white and live in a $60,000 a year household income or higher. But if you're not all white and all right at 60, once you start looking at the poor, then you're bad. And I think those ranking systems are evil. But I want to ask you another question. You said something at the beginning of the seminar, or this podcast. You said that you get 27,000 applications for your few seats at the school or whatever. And the bottom line is, all the dentists on Dental Town, they think there's too many dental schools, and why don't they shut them down, and why don't they make them smaller? And so Jack, why don't you shut down your dental school and make it smaller?
Well, I think I love the size because the graduates make a difference. They come from rural communities. They come from states that don't have dental schools. That was one of the things that I wanted, was recruiting young men and women from states that don't have dental schools where they can go back and help their communities. I think we don't have too many dental schools. What we may have is too many people going in that go in for the wrong reasons. They go in because they want to, have a couple of practices or this or that. I think one of the things that I thought was great was that we took care of so many, you mentioned it, American Indians and rural Americans from rural communities throughout the states. I think we don't have too many dental schools. What we need is continue to graduate dentists. We had a dinner recently where they honored me. Over 100 people showed up to honor me at this dinner in Phoenix. And I was taken aback. And they all said, thank you, because we're working with people that need us, and we're proud of it, and we owe it to you for taking us into dental school and letting us realize how effective we can be, still make a good living, but make a difference in people's lives and improving the health of America.
So there's been some new changes with the Big Beautiful Bill, student loan money and things like that. Now, of course, it's all noise, because it doesn't go in effect for 2 years, which will be a whole different Congress. So I was a freshman in college in 1980. 1980 is when I graduated from high school, went to Creighton. And from 80 to 2025, what is that? 45 years. The only thing American politicians have done is just kick the can down the road. They've never tried to solve a single damn problem. So when these kids talk about all these changes coming up in the dental school, I'm glad you're young enough to think there'll be a change, but they don't change in D.C. They're just kick stuff down the road. But a lot of the critics are saying that the dental schools are just too damn expensive. What do you say to that? And do you think there'll be a change in student loan available money? And what do you think the future is?
I think they are. I agree with you. Sorry to interrupt you, but think they are. I think they expensive, and that's the manufacturer. The equipment is just so pricey. And I think we got to do more to support these young men and women. That's why I love getting them from states without dental schools, and giving them a chance to go back and make a difference. I think we need more dentists, effective dentists that are able to impact, and even hygienists. I think dental hygienists can make a big difference in improving the health of their patients in a lot of ways. Flossing teeth is a real benefit. It's not expensive for an individual to do, but boy, can it make their teeth healthier. So I think we have opportunities to make a difference in people's lives from a dental perspective.
Well, actually, Jack, news alert. I just read the New York Times article from, what was it, 10 years ago, that there's no evidence to support flossing. So that, remember when
Oh,
they said,
crazy. Yeah,
yeah,
crazy.
but I get it though. I mean, what would you do? You'd have to have identical twins raised
Yeah.
apart, identical diets. One flosses, one doesn't. That's the
Yep,
gold
yeah,
standard.
yes.
So they're never going to approve
Not
it.
easy.
But last but not least, you left a city. I mean, I know your dental school is in Mesa, Arizona, but it's the Phoenix Metro, which just passed 5 million people metro. And now you moved to Jerome that doesn't even have 500 people. How the hell do you go from 5 million to 500? And what the hell do you even do up there in Jerome?
I do. Well, I was the mayor, so I did a lot. And we have only five a few people, but we have thousands of visitors. We're up in the mountains from our town. We have an 81-mile view across the valley through the mountains. That is spectacular. We've got some gourmet restaurants up here. I love living here. My wife and I, Jamie, we came up here just to check it out. We found a house. We were able to buy it. We wound up getting married up here, and it's wonderful. We're lucky, and I think Arizona is lovely, and I highly recommend it. And I think that being up here is good for me. I had a near stroke. I was in the hospital for 6 weeks. I was literally dead. They took me down in a helicopter, and it took a day and a half and brought me back to life. So I'm fortunate to be alive. I'm fortunate that my book came out. I was afraid I was going to croak before it came out. So I'm glad it's out. I'm glad guys like you, who I value your opinion, your contribution to improving health in America, like it and have it out there. I want people to get it. I'm not getting any money from it, but I want people to know that they can go out and make a positive difference in the world. And I love living up here, not in a major town like Phoenix. It's just too crazy. The traffic lights, the traffic, and blah, blah, blah.
I will say recently we went down to Phoenix. We went to Brighter Way Institute. They named a surgical suite after Jack down there. And and
Chris,
Jamie and I went with him. And Jamie was driving and her GPS went kaput and neither one of us knew how to get the hell out of Phoenix, but Jack remembered. Jack was in the back seat telling us, "Oh, turn left here, turn right." Like he still remembers his way around Phoenix like it was yesterday. And thank goodness because neither one of us had a clue how to get out of the city, but it was really moving being there and hearing these stories of patients at the Brighter Way who had had the restorative dentistry work done through them, how having their teeth repaired through that free program completely changed their lives, got them off the street, got them off drugs, got them into housing, they were able to get a job, like just being able to show up for a job interview with a full set of teeth. I was bawling. I know you were moved to
Yeah,
tears.
no,
Like,
it's wonderful that we can make a difference. Public health, you do a little bit of public health in Arizona. You can make a real positive difference in people's lives. So I encourage that, and you'll still make a fabulous living as well. Thank you all for listening to this. Thank you for what you do and the contributions you make to make Phoenix and Arizona a better place. And I'm honored that I'm able to contribute it and did this book. You don't know Jack, but boy, you can make a difference if you did.
Jack,
Thank you.
you're my idol. You're my mentor. Michelle, thank you so much for coming to the show. Thank you very, very much.
Thank you so much. Best wishes. Bye bye now.